It's Red Friday throughout Chiefs Kingdom, even though our boys are off this weekend as they get ready for Super Bowl in Las Vegas, of course. Today, you should be wearing red for another season. As part of Heart Health Month, today is National Wear Red Day, and it's to raise awareness about heart disease. So did you know this? Heart disease is the #1 killer of women across the United States. So Dr. Tracy Stevens joins us here from St. Luke's Muriel and Kaufman Women's Heart Center. How are you doing, Tracy?
I'm doing great.
Thank you so much for joining us. We really appreciate it. We want to welcome you and we want to know, why is education on women's health so important?
It's so important. Like you said, this is our #1 health threat. Heart attack and stroke is the #1 health threat to women. And it kills more women, has killed more women than men every year, killing more women than all forms of cancer combined. And it's important to become educated about what risk factors we have that make us at risk. And while a lot of these risk factors are common between men and women, we know that there are some less common or non-traditional risk factors unique only to women, and also cardiovascular conditions unique to women that present 9-to-1 women versus men. And unfortunately, we don't have the research to understand it, to give ideas, guidelines on diagnosis, treatment. And so it's important to be educated about risk factors and then embrace that we need to continue our efforts with research too.
Absolutely. And so talking about, being aware, being educated, knowing what's happening, we want to know, how do symptoms of heart attacks look different in women compared to men?
We can have the Hollywood heart attack, where the elephant, the crushing sensation on our chest. But there are a lot of unique symptoms that I usually say, from your waist on up, if it's a new symptom, think, could this be my heart? As physicians, we often ask, do you have chest pain? And that's not often the symptom. It can be shortness of breath, indigestion, pain between the shoulder blades, palpitations, just an isolated elbow discomfort, or toothache. Wow. So again, anything from the waist on up. Another symptom I'm very concerned about when I hear in women is overwhelming fatigue.
Yeah, that's something that a lot of us struggle with. And now, we know we've educated ourselves a little bit. Talk to us about some tips, for folks that really can reduce the risk for heart disease.
I think the most important message is the best way to treat heart disease is to prevent it. And most of these cardiovascular conditions common in our country with men and women, heart attack from plaque buildup, with discipline, we can reduce our risk by 95%. But it takes discipline. And these strategies include: eat healthy, stay active, maintain ideal body weight, don't smoke, limit alcohol, avoid prolonged sitting. And with that, self-monitor blood pressure. High blood pressure is the silent killer. And we can't get rid of stress, but how do we deal with stress? These strategies markedly reduce our risk of traditional heart attack and stroke.
So when it comes to women's heart health, why is research so important?
Research is so important more than ever because women have been underrepresented in research. The way we treat cardiovascular conditions largely has been based on studies in middle-aged men. And especially now with these unique conditions that we're not sure if it's more common or we've just become wiser, but the research is lacking. Women have not, for various reasons, been represented in research. And I'm really proud of our team, the Women's Heart Center, where we have embraced the mission of empowering women to take ownership of their health, to understand their traditional and non-traditional risk factors, but also to understand the non-traditional conditions that recognizing we don't have the research in.
Absolutely. And thank you so much for taking your time and joining us with some tips. And if you guys would like more of those tips, we have a link to this page on St. Luke's website. Just head to ours, kshb.com.